Hello and welcome to the inaugural edition of the Albany Herald and Clayton News Daily Wellness Expo virtual event presented by Southern Regional Medical Center. My name is Kim Golden-Benner. I'm the Director of Business Development, Marketing and Communications here at Southern Regional. We are so excited to be here today and be part of this great event to share important information on topical health subjects in a virtual format. While we would love to gather in person, for now at least, circumstances dictate that we meet with you in a more pragmatic manner. We feel so strongly that the health information and answering your wellness questions is so very important, so we are decided to come to you in this manner to talk about key health concerns. Today is the first of our 4 virtual events, and I'm thrilled to introduce the speakers to you who will share important information. Information on tips on becoming a healthier you that will touch on reducing your risk of diabetes, controlling your health destiny, and making positive changes in your life. Also, tips on achieving a healthy weight, including what is a healthy weight and what does that all mean for you about weight loss and guidance. We're going to share information on brain and spine health, as well as women's health, why it's so important that you as a woman take care of yourself when you often put others ahead of your own care. Before we begin, I want to thank our presenting sponsors, Southern Regional Medical Center, as well as our supporting sponsors and preferred vendors, which includes Ingalls, Fern Bank Museum of Natural History, Albany Herald, Clayton News, Rockdale-Newton Citizens, Jackson Progress Argus, and our friends at Feld Entertainment, bringing Monster Jam and Supercross to Atlanta Motor Speedway this month, as well as Disney on Ice to the Infinite Energy Center. If you have any questions or topics that you would like to see us cover in the future, please feel free to post them during the presentation or email them to us at events@scompapers.com. We will make sure that you receive answers and feedback. You can also view this event in its entirety or watch parts of particular interest to you starting tomorrow on henryherald.com, newsdaily.com, and for the next few weeks at thewellnessexpo.com. Now I'd like to introduce Dr. Christian Karbucha. Dr. Karbucha is board certified by the American Board of Internal Medicine and provides comprehensive medical care for adult patients. Whether a patient needs routine preventative care or long-term continued guidance and treatment, his practice is dedicated to meeting the needs of all of his patients. Thank you so much for being here today and imparting some of your wisdom on good, healthy choices. So we know that spring is here. It's a perfect time to make some really good, healthy choices. And what are some tips that you can give our public about things that they can do? I mean, we've got better vegetable selection now. There's all kinds of things going on. So what are some good tips that you can give us?
Well, as the weather starts to get warmer, you definitely want to start doing more physical activity.
Right.
Being outdoors is very important. It's a good source of making vitamin D, which we know is really important for our immune system. However, we do have to know that because pollen season is here now, if you are somebody who suffers from asthma or seasonal allergies, you might want to consider have proper medication in case you start having some of those symptoms from allergies.
Yeah, you know, in Georgia we've got that, I like to call it the yellow scourge, the yellow
Exactly.
pollen so we have a lot of people. So if you have COPD or something like that, this is going to really affect you.
Correct. You definitely want to have some medication, maybe talk to your healthcare provider and make sure that you have anything in case you have some symptoms.
Now that we are masking all the time and still masking probably most of this year, is that something that would actually help you when you're outside?
Yes, it can definitely protect you. However, we know that there's always particles that can go through the mask. Mm-hmm. So you want to make sure if you're somebody who has a very severe reaction, then you might want to have something in case of.
Awesome. So I know that at least in the communities that we serve around here, diabetes is really prevalent. We have a high amount of diabetes in America, but especially in our counties around this area at Southern Regional and Clayton County. So what advice do you give to patients to help them reduce the risk of diabetes or pre-diabetes? What are the things that we can do, the steps that we can take now to reduce our risk, or then if we get diabetes, how to manage all that?
Perfect. That's a great question. Well, the first thing that we have to know is that diabetes is a condition that is characterized by abnormal metabolism of your carbohydrates. So you want to be well educated about what are carbohydrates and how much of those are you eating every day, and if you're eating the proper carbohydrates. In general, you want to make sure that you are eating the least amount of refined grains, refined sugar that you can. Try to avoid any processed food. And definitely physical activity is something that can help you lower your sugar levels without the need of medication.
Right. That's really very sound advice, and I guess all those mashed potatoes I eat I need to cut back on, huh? That's not good for us.
That's not good for us.
What are some really good health tips, some positive things that you can give us? 2 or 3 things. I know physical activity as it's getting warmer. How many vegetables? How should we balance our plates so that we're getting better diet? Maybe not even realizing we're getting better diet, but just adding 1 or 2 things to the plate that may make a difference.
You always want to have throughout the day maybe somewhere around 5 to 7 servings of vegetables and fruit. What I tell most of my patients is just to divide their plates in quadrants. Half of your plate should be only vegetables. Then the other half you can divide it on 2. 1 for protein sources like meat, chicken, fish, and then the other half for carbohydrates, which is something like rice, potatoes, and sweet potatoes.
Okay.
Other important health tips that we can advise patients on top of the physical activity, you also want to do things that kind of help you deal with stress. So surround yourself with positive people, do outdoor activities, and try to stay away from a lot of negative news and other influence.
Well, and of course, as we still continue with this pandemic, that's who would have known a year ago that we'd still be where we are today, and the vaccines are helping, but we're still going to be wearing masks, and it's still stressful. So what other stress relief things can you do? You can maybe walk,
That's a very good question. There's many strategies that you can do to help you deal with stress. Meditation, deep breathing exercises, yoga can help as well. However, if you by any chance notice any changes on a loved one, you want to make sure that you are encouraging them to try to talk to their healthcare providers. We know that maybe less than 50% of the patients with depression don't receive any treatment because they don't look for any help. So you want to make sure to inform your loved ones of that.
So keep your eye on that. So if somebody's behavior has changed or their attitude has changed, it's okay to talk to them and tell them to go seek care.
I agree with that. There's other advices that you can give them. You want them to maybe get in touch with more people, get in touch with their communities, and get in touch with any faith-based institutions like a church. That can be helpful as well.
Whatever gives them peace and gets them on the right track. So I know we also have a number of senior adults in our area. I'm one of them. So what's a good thing? What should senior adults be doing to keep themselves good? I'm very active, but not every senior adult can be active. So what are there things that you can recommend for those of us who are a little bit more seasoned and both active and inactive? If you can't get around, what can you do?
Well, on our senior population, there's definitely multiple important advices that we can give to help them improve their health. The first thing is that disease prevention, and how you do disease prevention in a senior patient. Definitely vaccinations, right? They want to be up to date with their influenza vaccine, now with the COVID vaccine, pneumonia vaccines. If you smoke, stop smoking. If you do alcohol or any drugs, you should stop doing that. Other than disease prevention, you also have, like you were well mentioning, physical activity.
Right.
We know that the elderly population, they get a lot of cardiovascular improvement and bone health improvement with physical activity. Now, if there's any restrictions for that patient to do or that individual to do any physical activity, you want to do supervised physical activity. Maybe you want to consider physical therapy or occupational therapy to help you kind of reach your goals under the supervision of a professional.
That sounds good. Is there anything, other little advice, tips that you would like to give us or just bestow upon us at this time that you could think of? I know that you are very physically active. You are very much into exercise and keeping yourself fit. Walking is a good thing.
Walking is a good thing. Running. Yeah, so another important health tip is definitely sleeping, because we know that poor sleep is the #1 cause of early aging, which it doesn't mean that you get older physically, but it means that your health is the health of somebody who is older. So you definitely want to promote that people try to sleep at least 7 to 9 hours every day and try to avoid as much technological distractions as they can.
Awesome. Thank you very much. Thank you again, Dr. Karbucha, for being here.
My
We
pleasure.
really appreciate it. Thank you, Dr. Karbucha, for that helpful information on making ourselves healthier. We'll be right back after a message from our presenting sponsor.
For 50 years, Southern Regional Medical Center has provided health care to the Southern Crescent communities. We've changed a lot, and today we're ranked as the #3 top large hospital in the state by Georgia Trend magazine. Check us out at southernregional.com.
Meet Otto. She's an Australian sea lion, one of the most endangered sea lions in the world. Join us as we follow Ranger Dirk and scientists around the world on an adventure to save these majestic creatures. Sea lions, life by a whisker.
Get tickets at fernbankmuseum.org.
Welcome back. I'm Kim Golden-Benner, Director of Business Development, Marketing, and Communications here at Southern Regional Medical Center. Before we head to our next doctor, I want to remind you that you can watch all or part of this program at your leisure after today on thewellnessexpo.com. Next, I'm excited to introduce Dr. Carlina Tuggle. Dr. Tuggle is board certified in general surgery by the American Board of Surgeons. She received her medical degree and completed her general surgery residency and internship at Howard University College of Medicine in Washington, D.C. Dr. Tuggle completed her fellowship in minimally invasive and bariatric surgery under Morehouse School of Medicine. She's the medical director of the Center for Bariatrics and Healthy Weight here at Southern Regional. In addition, Dr. Tuggle is an active officer in the U.S. Army Reserve and is a veteran of military war missions in Afghanistan and Kuwait. Dr. Tuggle, thank you so much for joining us today. We are really appreciative of having you and you imparting some wisdom on us about weight loss and obesity and how extra weight really is not healthy for you. So we do know that, in the world today, I think I looked at some data, Georgia, 31.6% of us are considered obese. We have too much weight on. So what are some tips that you can share with us and to help us, for those of us who want to just lose a few pounds or really need to lose weight? Even if you really need to lose weight, you should start somewhere. So what are some easier tips or meal planning, or what are some things that you can share with us that would help get people on the right track?
Of course. It sounds like an easy thing to address. Don't do this or do more of that. However, a lot about what we eat or what we don't eat is based upon our perception of what we believe is healthy, what we believe is affordable. So I think the first thing, if you're going to consider changing your behavior to help adjust your weight, is to really take a list and introspection about what are you doing. Write down the types of foods you're eating, write down how many times you're eating out, write down even the calories that you drink. Oftentimes people don't realize that there's a lot of empty calories in beverages. And beverages do not make you full. It adds flavor to your meal, but one soda could have 40 grams of just sugar in it. And that's just the soda. That doesn't include the spaghetti you had with the bread and the dessert. So I think the first thing people need to do, in order to know what to change, you have to know what you're already doing. So instead of just throwing a tip, you got to see, because everybody's tips are going to be different. So it's really just saying, I want to make a change today. Let me start by just taking an inventory about what are my habits, what are things that I feel I should change or need to decrease or increase before implementing anything. So it's really just figuring out, where are you in this journey?
Got you. So like fried cauliflower, even though it's a vegetable, probably isn't good for you.
Not for every day.
Not for every day.
It's better than probably fried butter, but it's not. I would not recommend that for an everyday food.
So speaking about vegetables, how many vegetables should you have? Like, you look at a plate of fruit. Is having too much fruit a bad thing? Like, where should you go with something like that?
So the recommendation is 3 to 5 fruits and veggies a day. Now, you're going to find different articles that say 6 to 8 or even higher, more veggies than fruits. There are certain fruits that have more carbs or sugars in them. So the lower glycemic fruits would be your berries and your apples. Really depending on what your individual health needs are would depend on how strict or how picky you need to be. So if you're a diabetic, you probably need to watch out more for the citrus and the melons and the peaches. Those have a lot of high sugar content.
Gotcha.
If you're someone who's really trying to watch your carbohydrates, the same thing. But you also have to consider how much is a serving, and that varies. And again, we really need to start doing more research so we can know exactly what we're doing. But what's also interesting, even given our best efforts, let's say you became a vegan, a vegetarian, the way that our food is even cultivated and grown, it doesn't even have the same amount of nutrients that it did 50 years ago because we're stripping the soils. So there's so many things to consider, and even if you were to eat all the fruits and veggies that you could, most people still need to supplement with vitamins because they're just not getting enough. So it's a little complicated, but you really just kind of need to do a little research, but try to get in as much as you can.
So it's like going to your local farmer's market kind of thing better than going to a huge grocery store? And would you get better homegrown? Is it better to buy local? I mean, I don't know. I'm just curious if will the soils be better there?
Probably not.
Okay, so it's still the same thing.
And it depends on access also. Okay. So once you're getting into like the amount an individual can eat, it's probably not going to make a difference. Now we're talking about, oh, I'm a wholesaler and I have bushels of it, possibly. But unless, you are doing from this dedicated farm where you know that their produce is superior, just get some veggies in at this point. I mean, oftentimes it's, do I do frozen, canned, or can I afford something that's fresh that's going to go bad in 2 days? So often you got to figure out what fits into your lifestyle.
Okay. All right, because I know we always eat fresh vegetables. So, I do the steaming or we eat them raw. So thinking that's better.
That's ideal.
Okay, oh good.
Frozen is almost as good as fresh, usually because they just quick freeze it.
Yes.
Canned should be your last option.
Because of salt.
Because there's preservatives and salt and such. Yeah. But frozen, it lasts longer and has just about as many nutrients as fresh. So that is a very good option,
Okay, good. When someone comes to you and seeks medical advice on losing weight because they've gotten to a point where now they can't get it under control for themselves, or they've had 55 fad diets, and we all know fad diets don't work because as soon as you stop it, you're right back to who you were 10 weeks before you started it. So what is the advice that you give a patient when they're coming to you and they're like, Doc, I got to do something?
So I kind of mentioned it earlier, but one of the first things that I ask someone is, what is your motivation for losing weight? So once you see me, usually it's because we're 100 pounds or more overweight, or I'm starting to get sick. I have really high blood pressure. I have diabetes. I have sleep apnea. My back hurts. I can't walk. So really understanding what is the driving force to start making a change when probably the majority of your life you've been doing things to get you where you are. Because we just can't undo these habits. So what is your why? Because that's always, or should always, refocus you when it gets hard, because none of this is easy. None of this is haphazard. It takes planning and it takes work. So what is your why? And then understanding, what are your weaknesses? Because I will say, oh, I have no idea why I'm overweight. I don't eat, I don't do this, and I'm clueless. But then it's very difficult to have a plan if you don't acknowledge what your part in your health situation is. So it's also recognition. Yeah, I do eat sweets at night. Oh, I do eat too many carbs. Oh, this, oh, that. So that's the second part, is recognizing what you're doing so we can form a plan. And then it's about taking the first step and understanding that I don't like to use the word diet like how you mentioned fad. It should not be something that's not sustainable. So when you say the word diet, it should be something you can do almost every day for the rest of your life. Not something that, oh, I can be really strict or really decrease my calories dramatically for a matter of weeks. Because most people literally cannot mentally cope with the weird, strange things you need to do to get this acute weight loss off. Your metabolism drops as a result. And then as soon as you go back to eating all the things you were eating, you gain more weight than you lost because we keep playing with your metabolism. So really, I like people to start thinking of, what is a diet routine or plan that you can do that's healthy, that is sustainable for every day? And that's the key. And if you can only tolerate it for a few weeks, then what's the point? It's not even worth doing it.
It's a lifestyle.
It's a lifestyle, exactly.
Is there any words of wisdom or something you would like to tell people, like something that you want them to know about the steps that they should take so that they can be, because we all know that being overweight just wreaks havoc on everything else in your life. I mean, like you said, sleep apnea, high blood pressure, diabetes, all those things come with being overweight. So what's, is there something you want to tell people that they should think about and they should do that would get them on the right track to a healthier them?
Of course. I think when it comes to health in general, but speaking about weight, it should be something that's thought about before you get to be 100, 200, 300 pounds overweight. So when you're 50 pounds overweight is when you say, maybe I should start to do something, because it only gets harder. I see patients that are otherwise healthy that are 200 plus pounds overweight, and they say, but I'm healthy. But health is literally just like a snapshot in time. Tomorrow you could have an illness. Next week you could have an illness. So part of my job is for people who come to me already ailing and sick, okay, how do we get you better? The ones that are not sick yet, how do I prevent what statistically is coming? The stats say once you get to be obese, morbidly obese, you're at risk of getting a number of things: high blood pressure, diabetes, increase in cancer, cardiovascular disease, strokes, premature death, 7 to 10 years robbed from you. It's probably going to happen. So instead of waiting till you're at that point, when it's early, figure out what you can do now. Don't wait until something hurts. Don't wait until, oh, I can't run after my kid because everything is bothering me. Start now, because tomorrow isn't promised anyway. So I think for everyone, and it's on their time, you have to be ready when you're ready, but don't wait for something to happen. Don't wait for it to get bad enough. The time is now, and it's baby steps, and it's talking to your PCP and figuring out, do you need a referral, or would you like a referral to see a bariatric surgeon? Do you need to see a dietitian? So what are things that you can actively do?
Too is it doesn't mean that you can't have. It just means that you have to have in moderation.
Exactly. More good days than bad. We're all humans and no one's perfect. So you have to do right most of the time, but you also can't beat yourself up when you fall off the wagon. And that's something that a lot of people struggle with. Well, oh, I messed up. I knew I couldn't do it anyway, so what's the point? That's the wrong, Every day you wake up is a day to do it again, do it better, do it different. So today is a bad day, who cares? Go to sleep, wake up, and start over like yesterday never happened. It's consistency and persistency that wins the race.
Thank you so much for taking time with us. I really appreciate it.
It was fun, thank you.
Thank you, Dr. Tuggle, and thank you for your service to our country as well. I'd like to take a minute to thank the folks making today's presentation possible, including our presenting sponsor, Southern Regional Medical Center, as well as our supporting sponsors and preferred vendors, including Ingalls, Fernbank Museum of Natural History, Henry Herald, Clayton News, Rockdale-Newton Citizens, Jackson Progress Argus, as well as Monster Jam and Supercross coming for the first time ever to the Atlanta Motor Speedway. Before our next presentation, please watch these messages from Feld Entertainment. Check out these exciting events that are coming in April and visit each show's website to learn the safety precautions they are taking that will enable you to enjoy entertainment in a safe environment with your family and friends.
Monster Jam fires up the engines. These world champion drivers push these trucks to the limit.
Welcome to the show. Welcome to the grind.
This is Monster Jam.
Monster Energy AMA Supercross and FIM World Championship. See the world's elite motocross riders race for the series points lead.
22 riders in the starting gate believe I will be champion.
Be there to see who wins the round at Atlanta Motor Speedway.
Unbelievable! I cannot believe what I just saw.
Don't miss Monster Energy Supercross action. April 10th, 13th, and 17th. Visit supercrosslive.com to get your tickets today.
I'd like to introduce our next keynote speaker from Southern Regional Medical Center, Dr. Jerry Walters. Dr. Walters is a native of Jackson, Mississippi, and a graduate of Tougaloo College and the Warren Albert Medical School of Brown University. He completed his neurosurgery residency at the University of Arkansas for Medical Sciences, where he received extensive training in both open and minimally invasive spine surgery. Dr. Walters promotes conservative therapy when appropriate and seeks to exhaust non-invasive treatment options until surgical intervention is warranted. He is a strong advocate for personalized medical treatment plans and works to partner with every patient to develop the best treatment approach for their specific condition. He and his team strive to provide each patient with peace of mind, not only for themselves, but for their families, through an otherwise difficult time in their lives. As a neurosurgeon, people always think, you know, your brain, that's what you're going to work on. And one of the patient quotes that you have on your website is, "It took a brain surgeon to fix my back." So I love that, because people may not always relate that. They may think orthopedic or whatever. So how, in layman's terms, does that relate? So from a neurosurgery perspective, how can you help ease back pain?
Yes, so that's a great question, and thank you for having me.
Absolutely.
I think, you know, from an initial, standpoint, whenever you hear neurosurgeon, most people zero in on the brain. Mm-hmm. It is the source. It represents a portion of what we do, but
Right.
certainly we operate on, or we provide treatment for both the brain and spine. Mm-hmm. We consider ourselves comprehensive specialists from the head to the toe with respect to the central and peripheral nervous system. Most of what we do is spine. Probably 70 to 80% of our
Really?
practice is spine.
Okay.
And so that always surprises patients.
Yeah.
We're brain surgeons, but we also do operate on the spine.
And how does it all equate?
So I like to liken it to the brain being the CPU, or the nucleus,
Okay.
the source,
Okay.
and the spine acting as sort of a relay station, where all the
Okay.
information is transmitted to our bodies.
Okay.
And it is very complex in that sense, but it's something that we're still continuing to refine new ways to treat spinal pain, spinal pathology, whether it's tumors, whether it's degenerative pain, whether it's any condition.
Chronic back pain.
Even chronic back pain, which represents most of what we do. We do trauma, we do, like I said, oncology, and we do degenerative diseases of the spine.
Interesting. Okay, so you did tell me a lot about what it is that you do. So I know I did some research, and they say 80% of all adults will have a back injury or back pain at some point. I fall in that 80%.
Yes.
A lot of us have it, and some people start very young with back injuries or what have you. So what's advice that you can give somebody to lessen the amount of damage that they're going to do to their back in their lifetime?
Well, fortunately, that 80%, most of which don't end up in my office. Otherwise, we'd be a lot busier than we are now. So that's a good thing. But what I would say is that first and foremost, practice good posture. Mm-hmm. And I have to remind myself all the time. Try to sit erect and try to practice good posture. That's a very important thing to do, to commit to, especially when you're young, to prevent spinal issues down the line. The second I would say is exercise. Okay. Exercise is extremely important for both maintaining your range of motion and also preventing those developing osteophytes, which ultimately cause pain.
Right.
And then thirdly, I would say if you're a smoker, stop. Stop smoking.
That's been a common theme around all the doctors. Stop smoking. It's not good for anything.
Absolutely. and there's no exception for the spine as well. Okay. Smokers have certainly increased rates of back pain, cervical pain, and also increased risk of having complications if they do have a procedure for their back.
I also think, like, if you gain weight in your belly, does that put strain?
Absolutely.
So that'll bring your back out of alignment.
Absolutely. I think that axial loading, the increased pressure from weight gain on your joints, on the soft tissue structures of your back, certainly rapidly advances that degenerative process. All of us, to some extent, will develop arthritis, whether it's in our knees, our elbows, any joint of the body, including our spine. But certainly if we're carrying around a more reasonable amount of weight, that definitely slows the development of that process.
What are some of the things that you can do to help reduce someone's pain that aren't surgical?
We like to consider ourselves a part of a multidisciplinary team.
Okay.
And that as the surgeon, we represent sometimes the last resort in the continuum of treating back and neck pain. We work very closely with physical therapists. We work with occupational therapists. We work with chiropractors. We have a very we have a lot of specialists that are able to contribute to pain management for the spine. And then personally, we also offer non-invasive treatments.
Okay.
We also offer injections.
Is that what a non-invasive treatment would be, an injection?
Yes, I would say more procedural-based non-invasive treatments like epidural injections, facet injections, and even trigger point injections as well.
Okay, so trigger point means that it's right at the area of the pain, or?
Right at the area of the pain, generally in a muscle. And those are procedures that we can do in the office that are very short, that are generally very well tolerated, that can actually make a big difference acutely in pain management.
So stroke is a leading cause of death in our country. We know that. High blood pressure contributes to stroke. What are the signs and symptoms that you can alert somebody? What should they be looking for if they think they're having an issue and it may be related to a stroke-related issue? How does that all pan out for them?
Yes. I would say the most common symptoms that we see are, so the three that I would definitely call any layperson's attention to are any abrupt facial droop.
Okay.
Speech, speech changes, slurred speech, absence of speech, and then any weakness of an extremity, arm, leg, or both. Okay. And so I always think about the mnemonic FAST, face, arm, speech, and then time. Because as soon as you can recognize those symptoms and call the appropriate healthcare personnel, the more likely we will be able to restore or preserve neurologic function.
So from a neurosurgeon standpoint, what are some tips that you can give us for good brain health?
So 3 tips. I would say number 1, first and foremost, try to get quality sleep. That is very, very important. And I have to remind myself to do that, particularly people that are high functioning, that are busy, always on the go. The one thing that most of us neglect is our sleep health, but it is incredibly important to get quality rest. And I mean 7 to 8 hours of uninterrupted sleep is a recommendation and has been shown to promote brain health long term. The second thing I would say is the old adage, if you don't use it, you lose it. There's a lot of truth to that. There's a lot of evidence coming out about the utility or the benefits of crossword puzzles, especially as we get older, or reading, or keeping the brain engaged. But not only is it important to do those things, but also social interaction is also equally as important. So making sure you surround yourself with friends and family and loved ones that can help promote your well-being and your general mental health as well.
So Zoom meetings with family right now, since we're still in
Absolutely.
a crazy COVID time.
It's
a little
hopefully
challenging.
the tide is turning, but yes.
Yeah. Is there anything else that you would like to share with our listeners, with what it is that a tip or two, or anything else from a neurological standpoint or neurosurgery, just what they should know overall? I
would say that most of my patients always come to their office whenever they're referred to a neurosurgery. They're so afraid. They're afraid that, am I going to have back surgery? Am I going to have brain surgery? Ultimately, I will say 80 to 90% of my patients are non-surgical. And so at Legacy Brain and Spine, myself and my partner, Dr. Saeed El-Shahabi, we are very conservative with respect to offering surgery only when necessary. And we are always very careful to exhaust all conservative options before surgery is recommended.
So don't worry about that, because there's
fear
other.
us.
Yeah,
we don't bite.
That's great. Yeah. Well, thank you for being with us today and giving us some of your time today. We really appreciate it.
Thank you. Thank you for having me. Thank you so much.
Thank you, Dr. Walters. Just a reminder that you can watch this presentation at your leisure tomorrow on all our local news websites and on the wellnessexpo.com. Before our next keynote speaker, please watch this message from one of our supporting sponsors and preferred vendor, Fernbank Museum of Natural History. Did you know that Fernbank has 75 acres of new outdoor nature adventures? Wildwoods and Fernbank Forest combine to highlight the natural world through immersive trails, educational programming, hands-on exhibits, and beautiful scenery. It's a great place for a relaxing walk. While there, make sure you visit their current special exhibit through May 9th, Maya, Hidden Worlds Revealed. Check it out.
Unlock ancient mysteries and buried secrets in Maya, Hidden Worlds Revealed. Explore a world of artifacts, tombs, architecture, and art. Get tickets at fernbankmuseum.org.
Having a baby is one of life's greatest joys. The Women's Center at Southern Regional partners with you and your doctor to create the best experience possible, and our beautiful center is backed by a Level 3 neonatal intensive care unit. Check us out at southernregional.com.
Welcome back. I want to take a minute to introduce you to our next keynote speaker. So many times women take care of everyone around them and neglect their own health. Dr. Tracy St Julian is going to talk to you about that today. Dr. St Julian is a board-certified obstetrician and gynecologist. She's been practicing in the Atlanta area since January of 2005. Dr. St Julian is also a certified robotic surgeon specializing in the treatment of uterine fibroids and abnormal uterine bleeding. Her undergraduate training was performed at Prairie View A&M University, for which she received a BS in biology with a minor in chemistry. After graduating from college, she worked as a laboratory technician at Baylor College of Medicine in Houston, Texas. Dr. St. Julian attended her first year of medical school in 1992 at the University of Texas Medical Branch and was also commissioned into the U.S. Army that same year. She received her Doctor of Medicine in 1996 and began a 4-year residency in obstetrics and gynecology at the National Capital Uniformed Services at Walter Reed Army Medical Center in Washington, D.C. and Bethesda, Maryland. Dr. St. Julian was assigned to Womack Army Medical Center at Fort Bragg after completion of her residency in 2000. Dr. St. Julian has special interest in young women's health. She prides herself on offering personalized care to her patients, and she is proud to have served in the U.S. Army. Dr. St. Julian, thank you so much for being with us here today to talk about women's health issues. We are so grateful to have you on our little expo.
No problem.
So we know that women often put their healthcare needs to the back of the burner and they take care of everybody else. Mm-hmm. Tell women what are the absolute annual checkups that they need to do to make sure that they maintain their health.
Well, essentially, as far as starting your annual exam, the recommended age is age 21.
Okay.
The exception to that is if you are HIV positive, then you might consider getting your pap smear sooner than that, or if you immunocompromised for whatever reason.
Mm-hmm.
Other than that, in the general population, it's recommended age 21 that you would start receiving your pap smears, which is your screening for cervical cancer that we get annually.
Okay. Mm-hmm. And what about breast exams? Because that's very important as well. And I know people do. When should you start doing a self-exam, and then when do you need to have a mammogram?
Mm-hmm. So as far as your self-exams, age 21 is more than appropriate. Obviously, you're going to have teenagers that what we call now is your breast assessment, I guess is the best way that's the new term that they say. You want to be aware of your breast. So even teenagers can start doing a breast assessment, looking at the skin, looking to determine whether or not there are any abnormalities as far as a mass, are they having leakage from their breasts, so things like that, just to see is it any different from the norm. So you can start in your teenage years doing that. Preferably every month you should be checking your breast. Now, as far as how often a physician would check your breast, that is typically at your annual exam once a year. Mm-hmm.
And then a mammogram starts. I know that they kind of changed they changed that. It's the American Cancer Society rating.
Yeah, and then the Cancer Task Force. So it's always a growing debate behind that. But I think the general consensus is that at age 40, you need to start receiving your mammograms, and then you need to receive that every year. The age that they typically recommend that you could probably stop is about age 75, but that's really something that you would need to discuss with the patient. If you have a patient who her life expectancy is going to be more than 10 years past 75, she's healthy, she's normal, then yeah, you may want to continue getting mammograms after 75.
But prenatal care is important for a pregnant woman. It's important for her, it's important for the baby. So what kind of advice can you give a woman who is maybe just finding out she's pregnant? What do you do to take care of yourself, during the pregnancy so that you ensure your health and the baby's health?
Yeah, that's a great question. I think a lot of times we underestimate the importance of having prenatal care. A lot of times women who have had multiple pregnancies, they get comfortable and complacent with, I've done this before, I know what I'm doing, everything's fine. I've had normal pregnancies in the past. I just don't think that's the best philosophy to take.
Okay.
Once you have established that you know that you're pregnant, whether that's a urine pregnancy test or a blood pregnancy test, it's probably a good time to at least contact your OBGYN to initiate care. As soon as you know that you're pregnant, start taking prenatal vitamins. That's very important. There are a lot of developmental things that occur very, very early in the pregnancy. So, having adequate amounts of folic acid, and which is generally in your prenatal vitamin, taking that as soon as you know. And then once you know that you're pregnant, arrange for your first OB visit. Now, depending on which practice you go to, your first OB visit may vary. It may be a situation that you may just have an exam, or you may get scheduled for an ultrasound, or they may have you come back to get scheduled for the ultrasound if we don't exactly know how far along you are. Typically, you will start to see evidence of a heartbeat on the ultrasound at about 6 to 7 weeks in the pregnancy. So I think the important thing is discussing past medical problems. So I have a history of high blood pressure. I have a history of diabetes. Your doctor needs to know that. I've had a blood clot before. That's very important because that patient may need to get started on anticoagulation therapy.
Right.
So starting as early as possible and being consistent with your OB care. A lot of things during a pregnancy can change very rapidly. One of the biggest and concerning things that can occur is preeclampsia. A patient can be completely normal one day and the next day or so have full-blown preeclampsia, which could be life-threatening to the mom and to the baby. So it's important to start early and to stay consistent.
So don't just eat well and stop drinking alcohol and all that. Stop smoking and all those other things that are generally good health
We still
tips.
need to see you.
You still need to be seen.
Yes,
that's
yes,
important.
exactly.
Women, especially as they get older, may have issues with bone density issues, osteoporosis, pre-osteoporosis. So what advice, is there something, should they be taking a vitamin? Should they have a bone density test? What advice would you give someone, maybe I'm thinking when you hit 50s, you may want to start thinking about that.
Yes, that's correct. Important. A lot of us are deficient in vitamin D, and there's a good chance that we may not be getting adequate amounts of calcium in our diet, just depending on what type of diet you're on. Obtaining vitamin D and calcium is important because for patients who are deficient in those, their bones tend to be softer. If my bones are softer, I'm at a higher risk of fracture. Typically, what we think of in older women is the risk of hip fracture.
Yep.
And all the sequelae that can happen with that as a result of being incapacitated with a hip fracture. So vitamin D and calcium are very important. So as far as your screening, your Dexa screening, which is basically a scan of your bones to determine whether the bones are dense. And usually you have 3 categories when you get your scan. You have normal, you'll have typically osteopenia, which is where you have a lower density, and then you have osteoporosis. So patients obviously who have osteoporosis, they're at a higher risk of fracture. And there's certain things that you can do in order to try to help prevent that, not smoking.
Right.
Smoking is not good for anything, particularly for your bone density. It's definitely not good. When you go into your physician, inquire about having your vitamin D levels checked. If your vitamin D levels aren't adequate, then it's probably a good time to start supplementation with that. Probably food sources, particularly like salmon, sardines, things like that. Those are high in vitamin D. Other than that, vitamin D is a little difficult to just kind of get with food.
With a diet.
Sun exposure can help to improve your vitamin D levels, but with everything that's been going on with COVID, most of us have been inside.
Right.
We didn't go on summer trips this last year, so a lot of patients did not get the sun exposure that they normally get, subsequently having vitamin D deficiency. So calcium, vitamin D, Exercising, super, super important. Using weights. If you have strong muscles, it helps to create strong bones. So using weight-bearing exercises in order to keep your bone strength up.
And then finally, we all know that women and women heart attacks are different than men heart attacks. So sometimes you may just think you have a little indigestion or whatever. What are some things that you can advise women if they feel a certain way, or what do you tell your patients for what to look out for?
Right. As far as particular symptoms, obviously, as you discussed, indigestion, are you having issues that you're having pain or discomfort in your arms, your upper extremities? Are you having issues that your lower extremities, you're not having proper circulation? All of these can be indicators that you have some degree of cardiovascular disease, whether it's blockage of the blood vessels in your heart, or whether it's blockage of the blood vessels in your lower extremities, preventing adequate circulation. So we're looking for sores on your feet that are not healing well. My feet are always cold. I don't understand why they're cold, and just loss of sensation in the lower extremity. So those are some of the subtle signs
that you might never even pick up on.
Might never
it's
even
not that
pick
crushing
up.
elephant on my chest
Right.
thing.
Yeah.
Yeah.
Exactly. And heart disease is the #1 killer
of women.
It is the #1 killer. And believe it or not, probably more women die of cardiovascular disease than men. We live longer than the men, but we have a higher incidence of heart disease and a higher incidence of stroke. So all of these things make it the #1 killer in women.
Again, probably because we're like, oh, it's just, you know, it's whatever I ate
it's
today.
It's a little stress.
Yeah. As we always put ourselves behind everybody else's care.
Exactly.
Is there any other wisdom you would like to impart on everybody, something that you think is really critical for women to know?
Take good care of yourself. I cannot stress it enough. We are the caretakers of everyone else, and we neglect our own health a lot of the time. And we have to do a lot of self-love, self-pampering. If we are not around to take care of everyone else, what is going to happen?
Right.
So it's so difficult for us because we're always taking care of others, and it's hard for us to take the position of being a little selfish. And I'm going to take this time out for myself. But simple things like, I'm going to dedicate 30 minutes to exercising 5 days a week. I need to do that. If I'm drinking moderately with my alcohol or more than moderate, okay, I'm going to cut back on my alcohol consumption. I need to seriously look at my diet. What am I consuming day in and day out? Like they say, garbage in, garbage out. So am I eating vegetables? Am I eating fruit? Am I increasing my fiber? Am I maintaining my weight? Maintaining your body mass index is incredibly important. I know, there's debate, I don't want to look that way. That's going to look too skinny. The reason for the BMI chart is because we have identified that if your BMI is in the obesity side, your risk of cardiovascular disease, diabetes, circular disorders, all these things, cancer, are increased as a result of your BMI being too high. So, yes, I need to get my BMI in a normal range. So that means I need to exercise, I need to have a normal weight, I need to eat right, I need to take care of myself.
Awesome. Thank you so much. Thank you, Dr. St. Julian, for the great advice for women, and thank you as well for your service to our country. Let's take a brief moment to watch this important information from our presenting sponsor.
Having chest pain? Experiencing symptoms of a stroke? Don't wait. Call 911 and know that Southern Regional Medical Center is home to an accredited chest pain center and primary stroke center.
Thanks again for joining us today. I'd like to take a minute to thank the folks making today's presentations possible, including our presenting sponsor, Southern Regional Medical Center, as well as our supporting sponsors and preferred vendors, including Ingalls, Fernbank Museum of Natural History, Henry Herald, Clayton News, Rockdale-Newton Citizens, Jackson Progress Argus, as well as Monster Energy Supercross and Monster Jam, both coming to the Atlanta Motor Speedway this month. I know we mentioned when you registered that we would be giving away door prizes during today's events. Check out the wellnessexpo.com to see if you've won anything today. If you win, you will also receive an email with all the details. COVID-19 has impacted our lives in so many ways. One thing it has done is help us to be more creative in presenting information like today's Wellness Expo in a virtual manner. Here's another fun Cook Along With Us virtual show coming next week on goodtastegwinnett.com.
Grab your friends or make it a date night in the comfort of your own home and join us this April for Good Taste Gwinnett. This year's event will be a virtual cooking showcase featuring local restaurant chefs whipping up their signature dishes and sharing their secret cooking tips. Watch for free each week and go to goodtastegwinnett.com for tickets and information. Special purchase of a VIP ticket receives a free goodie bag. Just make sure you don't leave any food lying around once you're done. Join us for Good Taste Gwinnett, powered by Jackson EMC and Publix Aprons Cooking School.
At Ingalls, we've been your neighbors since 1963, and we've been through a lot together. Side by side, we've weathered hurricanes, wildfires, tornadoes, and floods. And always, we've been there to pick each other up, dust each other off, and get back to living. We can do it again. We're here. We've been here, and we're not going anywhere. Ingalls, we're with you every step of the way.
Welcome back. I'm Kim Golden-Benner, the Director of Business Development, Marketing, and Communications here at Southern Regional Medical Center. Before we head to our next presentation, I want to remind you that you can watch all or part of this program at your leisure after today on the wellnessexpo.com. I would also like to thank those making today's event possible, including our presenting sponsor, Southern Regional Medical Center. Next, we have Leah Mcgrath, who is the Ingalls dietitian. She's been a registered dietitian since 1996. She holds degrees in speech communication and human nutrition and has completed coursework towards a master's degree in marketing. Leah completed her dietetic internship with the U.S. Army at Walter Reed Army Medical Center in Washington, D.C., and then became the chief clinical dietitian at Moncrief Army Hospital, Fort Jackson in Columbia, South Carolina. Afterwards, Leah worked for almost 2 years with South Carolina Department of Public Health. In 2000, Leah accepted the position with Ingalls Supermarket as their corporate dietitian.
Hi, I'm Leah Mcgrath. I'm the registered dietitian for Ingalls Supermarkets. You can find me by going to the Ingalls website at ingalls-markets.com and click on the dietitian tab. You can also find me on Twitter as Ingalls Dietitian and on Facebook as Leah Mcgrath Dietitian. One of the most popular questions I've been getting asked these days is about the keto diet. This is a kind of a fad diet that some people are trying out. It's very similar to the old Atkins diet, if you remember that. The keto diet restricts carbohydrates. Carbohydrates, along with protein and fat, are macronutrients. The problem with a diet that restricts carbohydrates is that carbohydrates are not the only thing that are found in food. Our food contains other things like vitamins, minerals, and fiber. So if you eliminate carbohydrates or severely restrict them, you're also restricting things like vitamins, minerals, and fiber. So we see that happening when people are eliminating bread, cereals, rice, pasta, fruits, starchy vegetables, beans, dairy products like milk and yogurt, and the list goes on. So will you lose weight on a keto diet? You probably will. Any type of diet that restricts food and therefore calories will enable you to lose weight. But the problem is, will you be able to maintain that diet in the long term and keep the weight off? And will you stay healthy while you're following that diet? Those are big questions. And many people do experience short and long-term problems following a keto diet. Everything from really bad breath to kidney stones and elevated cholesterol. So ask yourself about any diet. Can you maintain it for the long term? Will you be healthy if you're on the diet? And what will your social life and your family life be like if you're following a highly restrictive diet? If you have questions about health or nutrition, be sure and reach out to me through the Ingles website or social media, where you can find me as Ingles Dietitian, or through our website, ingles-markets.com.
Thank you for joining us today for Wellness Expo virtual event presented by Southern Regional Medical Center. You can view this event in its entirety or watch particular areas of interest starting tomorrow on our local news websites and over the next few months on the wellnessexpo.com. Be sure to sign up for our next 3 virtual Wellness Expos coming on June 25th, September 25th, and November 25th. Sign up today at thewellnessexpo.com. Thank you again to our presenting sponsor, Southern Regional Medical Center, as well as our supporting sponsors and preferred vendors, including Ingles, Fernbank Museum of Natural History, Henry Herald, Clayton News, Rockdale-Newton Citizen, and Jackson Progress Argus. For information on sponsorship, please contact Marianne Holland, 816-489-8742, or email marianne.holland@henryherald.com. Don't forget, there are some fun things coming to Atlanta this month, including Disney on Ice, April 15th through the 25th at Infinite Energy Center. Monster Jam, April 24 and 25 at the Atlanta Motor Speedway, and Monster Energy Supercross final event on April 17th, also at the Atlanta Motor Speedway. Keep healthy, and we'll see you again at the June 25th Wellness Expo right here at thewellnessexpo.com. Have a great day.
At Southern Regional's Center for Healthy Weight, it's not just about the weight you lose, it's about the life you gain. If you struggle with weight issues, our center's comprehensive weight loss program may be the option for you. Check us out at southernregional.com.
Disney on Ice invites you to dream big. Join Moana on her journey to believe in herself. Be inspired by Miguel's passion. Rediscover the power of love with Anna and Elsa, and see how anything is possible when you explore your world. Disney on Ice presents Dream Big.
Monster Jam fires up the engines. These world champion drivers push these trucks to the limit.
Welcome to the show. Welcome to the grind.
This is Monster Jam.
Monster Energy AMA Supercross and FIM World Championship. See the world's elite motocross riders race for the series points lead.
22 riders in the starting gate believe I will be champion.
Be there to see who wins the round at Atlanta Motor Speedway.
Unbelievable! I cannot believe what I just saw.
Don't miss Monster Energy Supercross action. April 10th, 13th, and 17th. Visit supercrosslive.com to get your tickets today.
Join us when the Generations Expo Live event returns to Gwinnett County Fairgrounds on Saturday, May 15th from 10 a.m. to 2 p.m. Visit with representatives from companies that offer services such as healthcare, senior lifestyle, wellness, nutrition, entertainment, and more, targeted for the 50-and-up boomers and seniors. Admission is free, and the first 200 will receive a goodie bag with special offers and sponsor gifts. Check out generationsexpo.com for more information and updates. That's Generations Expo Live event presented by Northeast Georgia Health System, May 15th. Register today at generationsexpo.com.